I don't ever want to treat an area that is hardwired for pleasure, like with pain, or something painful, because often
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronsky, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. Hi friends, Dr. Susie G here, and welcome to another In Your Pants podcast. On today's show, I have Jocelyn Kirton, who is a registered massage therapist in British Columbia, Canada. Jocelyn and I talk about the role that massage therapy plays in pelvic and sexual health concerns. Jocelyn walks us through her biopsychosocial approach when working with her clients. And we have a discussion about internal manual therapy and how that may or may not fit within the massage therapy scope of practice. We also talk about the challenges and some of the pushback within the massage therapy profession when it comes to being an advocate for sexual and pelvic health concerns within the massage therapy space. Jocelyn provides us with practical ways to bring up perhaps difficult conversations or wanting to add sexual and pelvic health as part of your treatment plan with your massage therapist. So she walks us through how to bring up these difficult conversations with your massage therapist from the person seeking massage therapy and services, and also from the perspective of the massage therapist of how to talk about bladder, bowel, and sexual health with your clients. We also broach the topic of sexual ambiguity, especially when addressing pelvic and sexual health concerns within the massage therapy spaces and elsewhere. We know how difficult it can be for any of us to talk about sexual health with other people. So there are some really awesome practical strategies, tips, and also amazing modeling of what it can be like to have a multidisciplinary support system for sexual and pelvic health concerns. You don't want to miss this one, and I hope you enjoy the show. To formally introduce our guest, Jocelyn Kirton has been a registered massage therapist in British Columbia, Canada since 2013. Her education and practical experiences have given her the unique opportunity to incorporate her knowledge base that serves people living with abdominal and pelvic pain. Jocelyn utilizes a biopsychosocial understanding of the people she works with to best serve their goals. With a combination of education, manual therapy, movement, and mindfulness, she collaborates on an individual management plan forward. In addition to her practice, Jocelyn impacts the massage therapy profession by educating registered massage therapists on the positive effect the profession can have for people dealing with abdominal and pelvic pain that is evidence-based and, above all, safe. I hope you enjoy this show. Jocelyn, welcome to the show. I'm so happy you're here.
Thank you so much for having me. This is like a dream come true for me. So I'm so happy to be here and have this conversation with you today.
Well, thank you. I'm very flattered and humbled, really, because you're going to be talking about several important topics around massage therapy and the role that massage therapy plays in pelvic health. So let's just start there. What does massage therapy play in pelvic health?
Okay, that's a big question. So if you need, me to expand on something a little bit more, just jump on in. So I've been working with pelvic health population for about 7 years now. And kind of at the beginning of my approach, it was kind of pretty mechanical. And then as I kind of started getting to know people, that's when I really started to understand the missing piece I feel massage brings to the pelvic health management table. And that is very much the exploration of touch that feels safe, feels good, and also helping people advocate for themselves, kind of, especially when we're dealing with pelvic health and elements of kind of sexual health. It's a really good way for people to kind of quote unquote help practice advocating for themselves, to explore kind of touch that feels good. Now, in my scope here, I don't do internal exams without a scope of practice for massage therapists in BC and Canada. But getting people kind of used to like certain phrasing or language to use to kind of help with that element in their life, if that's impacted, helping people kind of manage aspects of mental health, not so much to the level of a psychologist, because again, scope issues there, but massage feels really good. It's really calming for the nervous system. It really helps modulate kind of someone's pain experience. And I find for a lot of people, it really brings an element of empowering them to be a self-advocate for themselves, whether that is with sexual partners or within the healthcare system itself. It also presents the opportunity for a massage therapist to be an advocate for people who are living with pelvic health concerns and pelvic pain. Because often in my practice, I see people who are very apprehensive and scared to interact with the medical system because of how invasive it can be. And when you surround yourself as a massage therapist, I surround myself with like-minded clinicians, pelvic floor, physiotherapy, urologists, gynecologists, midwifery. When you have like a like-minded team behind you, making those meaningful referrals, and that's a topic I'll probably keep circling back to, is really one of the best things you can do as a massage therapist. We have time on our side when we work with people. We spend anywhere between 30 to 90 minutes with someone, and it really gives us the platform to establish strong therapeutic rapport and alliances with people under our care, which I've seen in my practice, makes people feel safer talking about certain sensitive elements that come with pelvic health concerns and issues. So that's kind of a in the box.
That's a big box. Well, you are filling some really big shoes here as far as advocacy for this particular niche or population group. And I can imagine how other people in the community, whether that's clients who come to see you or patients, and even other health professionals, or even within your own profession, how there might be some pushback, really, because it's not traditionally just, it's not a traditional thing you hear as far as massage therapy being an advocate for pelvic health, or being one, I don't know where physiotherapy started to claim pelvic therapy or pelvic health. I have to say, I gotta have to name, like, I don't know where that came from, but we don't own, we don't, as a physiotherapist, as a physical therapist, I'm here to say we don't own pelvic health. And the fact that you're bold and courageous to say, hey, we have a role to play as licensed massage therapists and body workers to help folks with pelvic pain, like you said, that are less invasive, that help to modulate the nervous system. So how has the community responded to your messaging?
Oof. There's been a spectrum. So I am really happy that you said that physio doesn't own kind of pelvic health management. I am very fortunate with the pelvic health physiotherapists in Victoria, the ones that know me. They're all curious about what I do, and in particular, two of them who I refer to regularly. We've learned a lot from each other, from interprofessional collaboration. I've been able to kind of go in and demonstrate like just non-specific touch that feels good through the area. I've been able to show them how to conduct a non-internal pelvic floor exam. Yeah. And our consent process with massage therapy here is very lengthy because we are a regulated healthcare profession in BC. And so even just going over like language during a consent process, they've been so open to that. So I'm really thankful. I haven't met a lot of pushback from the pelvic health kind of physiotherapy community. For the most part, they've been very embracing and they're very curious what I do, which is awesome. I've met a lot of pushback from the massage community. And yeah, and this is where like I've had a lot of online scandal in the last year, particularly because everything about my practice and the way that I approach care challenges traditionalism within the massage therapy culture. Mm-hmm. And one of those elements is working with penis owning individuals. Woo! Yes! They have pelvises too. Hate to break it to you. And talking about things like physical arousal, erections, sexual health, having just conversations and dialogue around like, that an erection during a massage is normal and going about kind of management strategies, being comfortable talking about that with people. Mm-hmm. I have made videos. I have made resources on how to navigate kind of that sexual ambiguous situations that come with those appointments. And for the most part, some people, especially kind of the individuals who've been in the profession for a longer period of time, that threatens legitimacy of massage therapy for them, I think. And so I met with a lot of discrediting backlash in the form of, being sexualized on platforms of over 3,000 of my colleagues. So it's existing as a woman on the internet is already hard enough. I don't worry about this, but apparently it bothers people in my community, how I move my body online, the language I use online, the fact that like I wear red lipstick and like it. Yeah.
Welcome to the club.
Yes. There is ingrained sexism here that I am really coming up to face and I'm challenging in my profession. So yeah, it's a spectrum. It's a large spectrum of how people react to my content. The people who have reached out to me, so just kind of patient or like the public, like mm-hmm. people that are living with pelvic health concerns, they love it. They've been nothing but supportive, even just to reach out and just provide some words of support. I'm so thankful to those people. And then also they kind of reached out and asked for some referrals as well. So it's a wide spectrum of reactions I've had.
Smorgasbord. Well, yeah, and that's so hard. And really, I just want to acknowledge the thank you really for sharing in your experiences, those challenges, because it's hard. It's hard when you're trying to change the narrative and when people are comfortable with the current paradigm. It's just comfort. And so when there's something different or new, then it really is that their own individual fear and their own internal identity and voices that they're hearing, but are being projected onto you. So it's unfortunate that you have to experience such behavior with some of that community, and also that those that support you are vocalizing their support and your boldness and courage, which is what encouraged me to get you on the show, because I was saying this off the air, and I admire your boldness and courage, and to just really be genuine and authentic as a female identified provider who does work with all pelvises, which includes those who own penises, which we know is controversial. It's very controversial.
Mm-hmm. And we need to, man, like there needs to be more of us who are looking that controversy in the face and just being like, I'm going to deal with this because this is an incredibly underserved population of people.
Yes.
And the fact that I can provide what I hope to be, what I intend to be, a safe space for someone to come in, regardless of who they are and what their goals are, and I want someone to come in and feel safe talking about sensitive topics in my practice. That is so important to me, and having the time to talk about those concerns is the foundation of my practice, really. Right. I just want to listen to people. I want to hear about you and what your concerns are and how I can help you within the means that I can.
Exactly. Shifting away from this idea of I understand to help me understand what you're going through. And again, expanding and challenging people's idea of what massage therapy is. I know even within my own profession as a physiotherapist, and a sex counselor of blending the two, that in itself, is very challenging for some individuals to embrace and talk about sex. And it's like, well, how can you not talk about sex and that person's history with their sexual self and work on the pelvis when you have an organ and a body part that has a function? It's like, going in for ankle rehab and someone talking about your knee or your back and saying like, not that that's not relevant, but it's so completely disregarding that part or anything that has to do with that part, and as you said, Jocelyn, so well, that there's a spectrum obviously of people's perspectives and really it comes down to a battle of perspectives.
And it's, people who kind of lack the insight to see that they're projecting, whether it's their, feelings or insecurities or whatever it is, onto me. That's what I deal with a lot of. So, when I try to kind of kindly unpack that sometimes with people, I mean, I have boundaries, right? And when someone is I've been called the madam of a brothel before. I've been called that I was selling my body for a course. That's
an interesting perspective.
Yeah, that's where I'm like, nope, I'm going to draw the line. And then I'm going to make a 17-minute rage video about why that is not okay.
Right. Yeah, exactly. That language and those comments are inappropriate and really not productive. I mean, what is the intention behind that? Right. I mean, other than in my opinion, to be malicious, or something's coming up for that individual that is stirring up an internal conflict with their own values and their own views around sexuality and their own internal rules, implicitly or explicitly known. That is when, that doesn't serve any healthy discussion or help even to open the conversation to getting to know one another and getting to know and understand. Maybe there's knowledge that they don't know that or that you don't know that they know. And it's like, how do we open up the dialogue in a safe and healthy way to understand each other better, not to attack one another?
Oh, yeah. And, I just was stirring the pot on that one too, because I just had enough of it. But I was like, for a profession, like in Canada, I'm not really sure about the scene in the United States. I do have American, or I guess your LMTs down there. And I have colleagues down there and we kind of try to hash out the cultural differences. But massage here is very much medical. It is very medicalized because we used to be a 3,000 hour program. Physio and massage therapy in BC grew up together. So yeah, we're siblings. So when there's a lot of this professionalism that I call it toxic professionalism that gets kind of perpetuated through the community because it's you're expected to behave a certain way. And if you violate those expectations from the community, you're just like booed off the internet, or they really do like shame you in any way that they can. And I just said, I don't think this is how healthcare professionals act. I don't think healthcare professionals should be sexualizing their colleagues on social media platforms. Like, this is, if we're going to talk about professionalism for a second here, how about you reflect on your own right now instead of projecting, whatever it is this is right now onto me. And that was met with, a lot of people liked that. And then there's also a lot of people who took issue with it, but that's just who I am. And I understand there's a lot about me that is kind of threatens the norm. And I'm always open to conversation and differing point of views. But I'm not okay with personal attacks and intentional ways of trying to discredit me or really any of my colleagues. So.
Right. Yeah, it comes down to respect and respecting each other, understanding, yes, we have different views and perspectives on, what our practices maybe should look like, or what our role is in particular situations, or with certain patient populations like pelvic health and so forth, and sexual health. And yes, can we still respect each other in that dialogue? So I appreciate I have no other words other than boldness, courage, and bravery that you are demonstrating and modeling for not only your profession, but for other practitioners or providers who have same feelings and want to push the boundaries and do something different, but might be afraid to do that because of some of the scrutiny that exists and the some of that might go on with that. So speaking of, I want to segue to, when you're working with clients directly and someone may bring up the topic of, how actually, this is what I'm trying to ask is, how can someone who wants to work with you or is working with you as a massage therapist bring up topics of, pelvic health or sexual health without feeling like they're going, there's this crossing of boundaries. Like, I don't know what's appropriate. How do I ask this? I don't want to tarnish the relationship. I often get this, I don't want them to take it the wrong way kind of quote, right? So, and I hear this a lot too from, penis owners who I work with a lot and who have had other practitioners and asked me, like, can we brainstorm ways to talk about how can I express what I need or what I'd like to explore in my therapeutic sessions without tarnishing the relationship or having the other person take it the wrong way? What are your thoughts, Jocelyn?
Okay, so when I read that question on your question sheet, my initial reaction to it was like, we should just be asking that question because, when I took your lovely course, was that a year-ish ago? And there was that stat about how 48% of cisgendered men believe that their healthcare professionals should be asking spontaneous questions about their sexual health. I was like, well, yeah, why can't we just be doing that? And then this shouldn't be a question, but unfortunately it is. So I'm going to kind of break this down into two parts. So for people who are seeking care or wanting to have that conversation with their massage therapist or healthcare provider, and then two, from the massage therapist aspect of things, because there's two really important pieces there. So first and foremost, if you're someone who is listening and you are wanting to, ask your massage therapist perhaps about lower abdominal, groin, hip massage. It kind of depends. Again, massage therapists, that the hip is different. Sometimes it's considered a sensitive area and somewhere here it's not. But I'm just going to throw it in there just to kind of cover all my bases. But if you are inquiring about that because you are someone that does live with, with pain or certain symptoms or like tension or whatever it is through the area, and you've noticed getting massage feels really good because it's helping modulate the nervous system, My biggest, like, don't do this is don't ask during the massage. Just because of the dynamic, like this kind of unspoken dynamic that exists, especially as someone, if you are someone who owns a penis, during a massage, especially when you're face up and you're asking, it can sometimes come across as like maybe it's awkward for you to have that conversation, but you kind of feel like you have a good rapport with your massage therapist. They might be perceiving that as like, oh, this person is trying to solicit something from me that I'm not about. Because the unfortunate reality with massage therapists is that we really have thrown the baby out with the bathwater when it comes to any elements of kind of sexual pieces that come up in clinical practice. So if that is something of interest to you, I would recommend when your massage therapist takes you into the treatment room, if there is a little bit of a sit down or there is a little bit of a conversation, we have to do full on assessments here. So sitting down and like getting to know you and collaborate with you is very much a real part of work here. I'm not sure what that looks like in other places in the world, but if there is a little bit of a short consult, just ask your massage therapist, hey, I do have concerns of a sensitive nature that I'm wondering if you can help me with. And I understand how this might come across, but I want to have this conversation with you just to establish like a comfort zone about talking about kind of my struggles with pelvic health. And if you want to throw in sexual health concerns in there too, go for it. And how I think massage can help me. Are you open to that? And if it's approached that way, I don't think you'll run into the problems of being misperceived and then being told to, the treatment's over, get out of the treatment room, you've sexualized the clinical nature of the environment, which in itself is kind of traumatic, at least for some people I've talked to. So if you want to bring that up with your massage therapist, or do it before you get on the treatment table, or you can do it afterwards. Just don't do it during, just to kind of prevent that misperception there. If you are a massage therapist listening to this right now, and you are wanting to get into focus in pelvic health, and you're kind of struggling with how to bring that topic up, or even just to have a conversation about how normal erections are, physical arousal is during a massage, don't have that conversation with people on the table. Just don't. Because that is also, as massage therapists, there's also the nasty reputation that we get where we as a community are known for the predatory nature that, you know, not all professionals, but there are the few who unfortunately abuse that position. So don't do it when someone is on the table, because we have to think for a second. That position of power, that dynamic, right? You have someone who is either semi or fully undressed underneath a thin sheet. You're standing over top of them. And that presents a lot of that's a huge position of power there that we need to be very mindful of. So sometimes during the massage, especially if there's conversation, you know, it might just come up. And the way that I kind of navigate that is like, hey, I want to validate and hear about your experiences and the things that and the goals that you're wanting to achieve within our time together. Let's save that for next time so that we can sit and have a face-to-face about it. So don't bring it up when someone's on the table. Don't use your like, I feel this is tight and now I'm going to use this to talk about your sexual health. Just don't do it. Because you don't know how that person is going to perceive that. And that can be that element of touch combined with a question that is sensitive in nature, that can also be misperceived as well. So don't do it. Again, the consult, that sit down session, that's probably the best time to have that conversation. Or if you've noticed something during the treatment, bring it up afterwards when someone is fully clothed and they have a clear option to leave if they don't feel comfortable with how you're conducting those questions. And the way you bring it up, keep it general. Do you have any concerns about your bladder bowel or sexual health that you would like to discuss with me today? And often you're met with, oh, no, it's fine. Everything's good. And then almost always the next appointment, they'll be like, so you asked a question. And then that's just kind of a great way to keep those, the door open to that conversation. And I always end that question if someone goes, no, I'm good. I'm like, okay, if that changes at all, like, feel free to just, ask me or bring that up and we can talk about that. So ask it, leave the door open, and then also knowing your boundaries within those conversations as well. Often, okay, don't get me wrong, love pelvic floor physiotherapy. Y'all bring like a much needed piece to the table. But the courses I have taken, some of them, there's kind of this, yeah, I know you're smiling right now. There's a little bit of this idea where it's like, it's a body part, who cares? Like, don't make it weird. Or if someone decides to share whatever it is that they want with you, you should applaud them because they feel comfortable sharing that amount of information with you. Absolutely true, 100%. But we also need to know our boundaries within those conversations, because as massage therapists, I often refer to us as the bartenders of musculoskeletal healthcare in that people like to talk. And the problem is when you're dealing with a topic that is sensitive in nature, if you are just expected to be a blank canvas and have someone just kind of divulge everything that they want to share with you onto that canvas, that might lead to blurred boundaries a little bit. And it might create more of like I call it girl talk or like a friendly, more of like a friendship dynamic instead of a professional one. So also understanding your sexual boundaries when it comes to those conversations and sitting down with yourself and unpacking, okay, what do I need to know? What do I need to know to provide care for this person versus what is just gossip? And I think that conversation doesn't happen enough within the pelvic health community.
Right. That intention, the intent of why are you what's the point of even asking a particular question?
Yeah.
How is that going to either one, allow that person to reflect perhaps on their situation in a different way, right? So more of a metacognitive process of insight and reflection. Or are you truly looking for some piece of information that might add to a meaningful clinical encounter that might maybe adjust the way what assessment tools you're going to use or what treatments you might offer? And so, yeah, I think you're right on. It's we shouldn't just arbitrarily be asking questions without purpose, but really taking the time to think about our intent and the impact that particular inquiry might have.
Exactly.
Yeah, no, thank you, Jocelyn. This is very wise advice. And I really appreciate the tangible, practical ways to even just down to like having like a script and saying it out loud, like even before you meet with your client or patient, because that's where we when we're caught off guard is when we tend to feel flustered and unprepared. And so what you just provided for providers and for folks who are seeking massage care or massage therapy is a way to practically ask the questions and practice that, talking to their fridge, for example, or in the car. Just say it out loud. Get used to saying it, because it takes the edge off of the fear and the uncomfortable and unpleasant feelings that might arise when we're trying to have these difficult conversations.
And I was going to say out there too, adding on to that, for any the people listening, just use me. I have this conversation all the time on Instagram with people reaching out. If you're scared, just like if you're worried or anxious about having this conversation, just throw me under the bus. Hey, there's this massage therapist I know who deals with like pelvic health, and I was wondering if that was something you did. And if not, if you could reach out to her and for some ideas. That has happened. So you can totally use me too.
I know. I like that. I like that.
Use me. Yeah. Like I heard this professional talk about it on a podcast. So
Yes.
yeah, you can use me as well. So
Exactly.
you do you.
Right on. High five, Jocelyn. I do the same thing. Like, hey, just
Yeah.
tell them it's me. Tell them it's me. If they
Yeah.
have any questions, they can call me. We can chat. We can have conversation around it if there's any confusion. Yeah. No, I get it. I love it. It's great. So I want to segue into, maybe for those who are listening who want to incorporate massage therapy and care into their, whether it's sexual health, pelvic health concerns. What can they expect? It sounds like you're really pioneering this
Yeah.
shift in the narrative. And
Mhm.
what can folks expect as far as working with you? What would that look like? What are some things that might be part of their therapeutic session that would address some of the pelvic and sexual health concerns they have?
Great question. So typically, like, as you're probably aware of, those lengthy intake forms, that's kind of part one. I understand how frustrating those forms can be, but I always kind of just preface them with, the more data you give me kind of before the appointment, the more I can get a sense of like the biology of kind of what's going on in an area, because I want the time that we have together, I want to focus on you. I don't want to be asking like these kind of menial, like, what is your bladder frequency like? How often are you going during the night? Like, you can answer those questions. So that's why those intake forms are very lengthy. So I apologize, but they just give me data. What I typically do, those appointments are about 90 minutes long. And we sit down, I get to know you, what your goals are, what your concerns are. And because it's like, this is kind of new coming to a massage therapist for a pelvic health concern, I open the door for like them to have questions regarding the nature of the treatment and their concerns if they have them. So one of the biggest things that comes up is the internal exam. Now, that was a question, and I think that's a whole other conversation in itself. We should circle
Which
back
we'll
to.
dive into, no pun intended.
Yes,
But I
yeah.
definitely do want to touch on the topic of massage therapist role with internal work.
Yeah. So internals are not within my scope of practice, and I make that very clear. And which is often why people come in to seek care from me, is that it is off the table, pun intended. So after I get to know someone and we establish kind of our boundaries in terms of what we're comfortable with treating, drape boundaries, and even like also movement and exercise prescription. Now that is within my scope of practice as a massage therapist in Canada. I know, yeah, thumbs up. Thankfully, that's not always the case everywhere else in the world. So I just asterisk that a little bit. And we kind of talk about their movement menu and what that looks like in regards to the area. During treatment, it kind of just depends on the person, but typically I'm doing a lot of work kind of through the pubic bone, low abdomen, kind of high groin. And then there are areas I can access the perineum kind of in and around the medial aspect of like the sits bone. But my scope is clear that I can't go beyond like the edge of the anal cleft, I think is how they've defined that. So
pretty precise.
Yeah, it is. So I can do a little bit of a, if we want to call it quote unquote pelvic floor assessment. What that involves is I'll just kind of put a hand there and I'll just ask someone, whatever you think, we want to call it a Kegel, sure. Whatever you think that is, I just want you to like do 5 of them for me, because I just kind of want to feel what's happening through the area. And then it's a lot of coaching and cueing and providing like, if something feels a little sticky with that motion, I'll maybe do a little bit of like a kind of like a traction or like a stretch through there. Or if something feels a little bit sensitive, I might do what we think looks like a trigger point release, but it's
I like
not.
that with air quotes. If you can't see Jocelyn, she's got funny quotes or air quotes.
Trigger point release. But basically
I'm with you.
what that is it's a tender area, and we work on kind of breathing and movement strategies to help modulate the tenderness there. But I'm asking someone like, does this feel better? Does that feel better? Which one do you prefer? because not everyone likes, what I call like a nociceptive driven experience through the area.
Can you clarify that? Can we pause for just a second? Sorry, I don't mean to interrupt you. When you say a how did you say that? A negative or nociceptive?
A nociceptive driven treatment.
Nociceptive driven treatment. Can you explain that to folks who might not know what nociception is?
Yeah, absolutely. So nociception is a noxious stimuli. We have a sensory apparatus that is involved in detecting them and transmitting that information further into the nervous system. And that plays a role in how you are perceiving or sensing an area. And so when I say nociceptive driven, it means probably a more intense, stimulating, that pain that feels good. I'm saying this in air quotes because of a lot of the pain literature I've read, the pain that feels good, but or the therapeutic pain that often gets labeled in massage therapy. That would be what I would consider a nociceptive driven treatment. So something you feel like you have to breathe through. And that face, that's the face I make too. I don't ever want to treat an area that is hardwired for pleasure, like with pain or something painful. Because often there's this idea of like no pain, no gain. And there's a disassociation that can happen when we are so focused on fixing, no matter the cost, versus engaging in mindfulness and things that feel good and pleasurable through that area. So I make that very clear to people. Like, it's you do you. It's your preference, but it doesn't have to hurt to feel better, is essentially how I sum that up. I'll do some coaching through there with, either with breathing. I like to also take a look at, if everything else in the area is involved too. So if we have kind of hip involvement, groin involvement, lower abdominal involvement with that in a way that perhaps isn't serving the area very well. It's just kind of unwinding those that motor pathway, those sensory pathways a little bit, and creating a foundation of kind of mindfulness and understanding of how the area functions before then taking that piece of control. I call it control the pelvic floor, and then implementing that back into activities of daily living that have been impacting. So whether that is toileting, squatting, certain sexual positions, or work, sitting for long periods of time, driving, whatever it is. We first focus on that whole coordination of the area and then taking that new information and then implementing it into activities of daily living.
I love it. I love it. For those that maybe see my face or just can't see my face, I am just all yummy right here because Jocelyn is speaking my love language. All that she just said. Yes, yes, yes. Yeah.
I often think from again, anecdotally here, from my perspective of dealing with this population is that the Kegeling often is just it's just focused on the movement, but taking that piece and then putting it back into activities often gets missed. So from what I've seen is that's actually a very important piece for people to understand, it's not just doing your Kegels or your relaxation exercises or lengthening. I call it the lift and length in practice because it just makes sense. But it's also taking that piece and then putting it back into meaningful activities of daily living. So
100%. How else are you supposed to integrate? Exactly. And that's
exactly. Yeah. And then the biggest part, so then the final piece of all of that is the beautiful part about my practice is that it gives people permission to feel good. And so I am typically during the massage, I'm showing people how to traction the area to recreate those I call it the yummy sensations through the area. And I took a Diane Jacobs dermal neuromodulating course. I have rolls of Dyson that live in my office, and I'm literally cutting off chunks of that and giving it to people. And just giving them permission to explore things that feel good through the area. And I think there's something powerful. Can correct me if I'm wrong here. I'm willing to be wrong, but there's something powerful about having a healthcare provider who understands their scope of practice and being like, okay, like I am not going to be massaging these areas for you, but you can do that at home if the area feels, really good. And there's no right or wrong way to explore that. And sometimes, like, I do have a model, like stuffies. And I will kind of show like some techniques that might feel good through the area, but I'm very clear that there is no right or wrong way in engaging with your body. And so we just want to focus on, if something is a little bit sensitive, like here's some breathing techniques, or here's another way you can approach it, or, focusing in kind of on like pleasurable sensations or sensations that feel really good, or even if they are just neutral in an area that is persistently painful, that's also a positive thing too. That can be a positive thing. So there's something about like, I'll kind of take the reins for a little bit in these areas, but then I'm going to give you the reins back to go self-explore. And there's something with a massage that's so powerful. I can't describe it, but I think that's probably one of the most important pieces that we have to offer as massage therapists in that regard.
I love it. It's a collaborative shared decision-making process with the person, and ultimately saying, hey, not being like reliant on an external or some provider, not saying that we're not helpful, certainly, but we're like you're saying, we're empowering that person to feel capable and resilient and independent and get their autonomy back for meaningful activities in their life, So
yeah.
Wow, amazing. We definitely need more folks like you for sure. And I appreciate all the work that you do in being an advocate for not only for your profession, but for breaking the mold and for helping going beyond that mold to really extend care to people that really need it and want it. And yeah, that's really awesome. Can we circle back briefly to the internal conversation?
Yes, we can.
Because in the United States, like in North Carolina, if to my knowledge, licensed massage therapists are allowed to do internal work. So but no one dares, so no one, I have broached this topic with other massage therapists in town, and no one broaches that area ever. It's like, well, no, we don't, yeah, I know we can, but we don't cross that line. So I'd like to talk to you about that, about the internal work controversy.
When I read that, I was shocked. That is so surprising to me. But at the same time, in BC, because we were trained with physiotherapy up until I think 1994, when we split into our own colleges, we were doing internals was very much a part of our educational curriculum. And then they took it out of our scope of practice when we became our own regulated healthcare profession. And I think that just has to go, especially in BC. Can't speak to the rest of Canada, but they're very stringent, like, this is your scope, this is your scope, this is your scope here. Mm-hmm. So it's very compartmentalized. And with that being said, it is every month I get a message or two from RMT, so registered massage therapists in Canada, who are asking if I would ever advocate for internal exams to be part of the scope of practice for a massage therapist. Uh-huh. And this is going to break some hearts. I'm sorry, everyone, but I am firmly in the camp that internal exams do not belong within the scope of practice of a massage therapist for a lot of reasons. The biggest one being that we do not have comprehensive sex education as a part of our education curriculum as massage therapists. So we are a very, what I like to label sexually avoidant profession kind of in general. Mm-hmm. And we don't have the skill set. If we're not even comfortable talking about how normal physical arousal or erections are during a massage, why are we insisting on doing an internal with someone? Like, why? I really fail to, if we don't have this education over here first to lay the foundation so that we're providing safe care for people, then like the modality of an internal exam, like that's not even on the table in terms of the way I'm looking at things right now. So that's kind of my biggest number one. Number two, it is not hard to go get an internal exam. There's a lot of healthcare professionals out there that will provide them. And especially here, pelvic floor physiotherapy is very popular. So again, the biggest thing we have going for us as massage therapists is that we provide a safe space for people to come in to, and yet that internal component is completely off the table. So they don't have to worry about like saying yes or no, potentially offending the healthcare provider, feeling like they're not getting proper care. I say that in air quotes. You can't see that, because people feel like if they refuse the internal, then the efficacy of the treatment goes down. And so they have a tendency, at least from what I've seen in practice and experienced in practice, is that they feel they have to go get this done in order to have a successful treatment. Right. And so as massage therapists, if that is not even offered, then it opens the question to like, well, what is it that you can do for me? And then I can have the conversation of pelvic floor therapy is not about the internal exam.
Right,
like
exactly.
It is a modality. It is a way of interacting with the area. But first and foremost, you need to consent to that. And it needs to be not, I don't know if there is actually a term in research literature around this, because I've read a couple kind of qualitative studies around kind of internal exams and pelvic floor physiotherapy and kind of the rates of dropout during research that's conducted. Medical consent versus kind of enthusiastic consent. And what we often see, or what I've seen in these papers, is people often have this idea of like, well, I'll put up with it if it means this helps other people. And yeah, so it's kind of compartmentalizing themselves away from, their body and what's going on with them. And so when that's not even offered, then I can just focus in on the person and their needs. So again, massage, we have our own seat at the table when it comes to pelvic health management. We offer a piece of the puzzle at the table. It just doesn't need to involve internal exams.
Right. 100%. And I'm clapping over here because that's messaging that should be across the board for all, healthcare providers who work with this population, that internal work is not necessary to feel better. And it is a consensual process every single time, and even throughout the examination process, to say you have permission to say no to any part of this therapeutic engagement, and respecting, right? Not pushing or forcing or feeling that someone needs to do something in order for you to do your job well.
Exactly. I agree. And then finally, with my profession being what it is, my concern of over the top, specific, mechanistic explanations. I took a course a couple years ago that was like suggesting that you could stretch specific muscles of the pelvic floor. And yeah, I like that.
Sorry. I have like a terrible game face. This is like terrible. I really need to work on my.
And I wrote an email back. I was pretty blunt. I was like, you can't, this is not helpful messaging in our community, and this is why. And if we did have internal exams as part of our scope of practice, I feel like the explanations would be over the top mechanical. And then on top of that, over the top, like palpation dependent.
Yes.
And I just think, as someone that studies a lot of pain and nocivic languages or scary messaging around, pain and, or even really symptomatic presentations of the pelvic floor and perineum. I would be just very, very concerned about that coming out from the massage community. So, I'm firmly in the camp that internal exams, they are helpful. They can be an important part of someone's healthcare and their management, but they don't need to be a part of the scope for a massage therapist.
Yeah. Thank you, Jocelyn. I would so appreciate your perspective and sharing all of this wisdom that you have with us today. I really appreciate it. And I do hope, and my wish is that this messaging continues and that we can all come to an agreement of, hey, we are just here in the best interest of the people that we serve or the people that we're supporting. So thank you so very much. So if folks wanted to reach out to you, connect with you, how could they do that?
Thanks for giving me a little shameless self-promotion here.
Of course.
So I'm most active on Instagram and Facebook, and that's just Jocelyn Kirton, RMT. So Kirton, Kirton. And then I do have a website, pelvicrnt.com. That's in the middle of getting updated right now, so it's kind of glitchy, but it's getting a bold new look to it because it was literally a WordPress website that I just kind of threw together last year. And what that is going to be offering is self-directed courses it's going to be more geared towards massage therapists, but really any healthcare provider. And also in-person courses as well. And then also I'm using it as a way to kind of build up management strategies for people living with pelvic floor or pelvic health, pelvic floor, abdominal concerns or pain or conditions that impact that area. And also, it's going to be providing a big resource in terms of navigating kind of sexual health concerns for healthcare professionals. So that's coming in the new year, and I'm really excited about that.
Awesome. Congratulations. I can't wait for all of that to be available as a resource for all of us. Thank you so very much. And you mentioned off the air you had a podcast?
Yeah. So I have, it's been rebranded now, but it's called Behind the Curtain. And it's just me kind of doing a monologuing. That's going to be coming out. The Fresh Face is coming out in the new year too.
Awesome.
And that's just kind of be me. It's more geared towards healthcare professionals than it is with people and the lived experience. But that's just kind of me talking about some of the traditionalisms and culture within the massage profession that need to change, and kind of unpacking kind of the uncomfortable unmentionables in the profession. So that's
said.
Coming out. That's coming out in the new year.
I can't wait. That's well said. Well, great. Exciting things. Again, wish you all the best with that. And thank you so much for being on the show.
Thank you so much for having me. This was great.
And to all of our viewers and listeners out there, thank you for watching and listening. And as always, in loving wellness for your pelvis, this is Dr. Susie G. Until next time.
Thanks for listening to today's episode. Be sure to visit my website, drsuzieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.